Welcome to episode 32 of Ping, a Firewalls.com podcast, a bi-weekly look at cybersecurity, including interviews, news, expert tips, and the latest trends. I'm Kevin Baxter, and I'm joined by my Firewalls.com colleague, Andrew Harmon.
There.
Hey, Andrew. As we tackle a different featured topic each episode. New ones are normally out every other Wednesday, so subscribe or follow on your favorite podcasting platform to get the latest first. Please do rate and review us, or you can drop us a line anytime at podcast@firewalls.com. As always, thanks for listening, and now it's time to introduce our featured topic and our guest for this episode.
Near the end of October, the FBI, the Department of Health and Human Services, and the Cybersecurity and Infrastructure Security Agency, whose James Stanley we had on our last episode, issued a joint warning to healthcare agencies in the U.S. A wave of ransomware attacks is incoming. And in some cases, they have come, with a number of hospitals currently under attack, in addition to many others that have already dealt with ransomware this year.
In fact, the percentage of healthcare organizations impacted by ransomware globally nearly doubled from 2.3% in the second quarter to 4% in the third quarter. With healthcare in the crosshairs, what are some of these organizations' greatest vulnerabilities, and how can they better protect themselves? To discuss, we welcome Barbara Vibbert, a pre-sales engineer with SonicWall, who also happens to know a few things about healthcare IT in particular. Barbara, thanks very much for joining us today.
Welcome. Happy to be here.
So before we get into the topic at hand, tell us a little bit about your position and your day-to-day at SonicWall.
So I'm a field sales engineer, which means that I work with a variety of customers in pretty much every vertical to help them figure out what network security solutions are going to help keep their environment safe. I am our healthcare specialist because prior to joining SonicWall, I had a lengthy period of time where I was in healthcare IT.
You recently helped put together an article for SonicWall on securing hospitals and the challenges that presents. Just last week, as we record this, the government issued a pretty dire warning about ransomware targeting U.S. healthcare providers. Why are these targets so particularly vulnerable?
I kind of go back to the question that was asked of Dillinger, why do you rob banks? That's where the money is. For healthcare, they have data that is monetizable. And they have a duty of care, which means that the integrity and availability of the data for the practice of care is of higher concern than the confidentiality, or as we would think of it, as privacy. So because of their priorities and the need to have that data available and its integrity be trusted, they're seen as targets that maybe have a softer edge. I don't think that's true of a lot of healthcare organizations these days. I think they've all hardened up considerably, but IT use in healthcare is so huge. We all think we understand healthcare because we all consume it. But what we see on the front end in healthcare is just the barest glimpse of all of the technology behind the scenes that is facilitating the practice of care. From hands-free voice communication to what the nurses typically call Johnny Fives, those computers on wheels that are in the patient rooms, to electronic health records. There's just a pretty big surface area to attack.
And so the vulnerability has been there for a while, but is a type of warning like this from the government common for, such a broad and kind of scary sounding issue approaching?
No, this isn't commonplace. It's part of the reason why the IT security community went a little nuts last week. We understand that healthcare is constantly under attack. Again, they have information that is monetizable by malicious actors, but this is part of a continuing trend. We dropped our quarterly update on the cybersecurity landscape late last week, and the United States saw 145.2 million ransomware hits, which is a 139% year-on-year increase. And the particular ransomware that is targeting healthcare that the government is alerting about is called Ryuk, and it made up 33.7% of all ransomware attacks this year.
And is there a particular reason why that strain of ransomware is being used?
Yes, unless you have advanced threat protection, heuristic machine learning, it is a polymorphic piece of malware. It kind of rewrites itself to evade detection automatically. So it's very effective, and it can evade some of the more traditional stateful firewall type protections. You really need something that's going to look at the behavior, not just try to match a signature.
And so ransomware attacks are, generally pretty harmful to any type of business. But for a healthcare provider in particular, why is it so damaging, not just to the business itself?
There's a few reasons. One of them is that billing is critical. We have large institutions that have huge bankrolls, and they're okay if they miss billing for a little bit. But if a regional hospital or community hospital misses a billing cycle, it could put the entire operation itself in danger. In terms of the healthcare vertical, especially, these ransomware attacks and malicious attacks that deny availability of all kinds can put people's lives in danger. So the malicious actors think they have a better chance of extorting payment from hospitals and clinics than they do from other businesses because, as for example, if a hospital ER has to go on bypass, that is that they're not accepting patients because they're backlogged because they're having to use paper systems, for example, people can die. And it's not just the publicity. The people who work in healthcare really care about people being healthy and not dying. So that's looked as a way to make them more exploitable.
Yeah, so we just had that case that made the news in the last month or so in Germany where a patient did actually die because of potentially not getting care fast enough.
That's right.
So focusing back on your article, you talk about 3 particular issues in terms of security that's unique to hospitals in 2020. The first being access control, second being IoT devices, specifically in medical-related devices, and teleworking. So on top of those 3, are there any other healthcare-specific vulnerabilities that they have to deal with?
Well, one of them is that healthcare has turned heavily to Wi-Fi. And there's been a transformation in the last 10 to 15 years where hospitals and clinics want to do everything on the Wi-Fi, which means they have a lot more wireless access points than a typical physical plant that size. And every one of those presents an opportunity for access. Another thing that they have is a lot of people who work in the hospital don't work for the hospital. Your physician likely belongs to a practice that is employed by the hospital and is not directly employed by the hospital. So they have a lot of other people's devices in their network and accessing their data. And it's not just physicians. Often nurses are visiting nurses and they come from a nursing practice. So whether or not your nurse in the hospital works for the hospital is not necessarily known. Some other things that can really be specific to hospitals is onboarding of physicians like residents and fellows. Typically that happens at a very short period of time, about 5 days. And they all have to be properly provisioned with the appropriate access and no more than they need. They may be issued laptops. They may be part of a medical school that issues them laptops, but they still need to have access with those things. And that happens every year as a predictable event. An unpredictable or less predictable event is something like a nursing strike. Nursing contracts typically have 3-year renewals, and if things aren't going well, they can threaten to strike. If it does come to a strike, the nurses do have to give the hospitals a certain amount of notice, but then they bring in replacement nurses, these visiting nurses, typically from all over the country, and they have to get them provisioned very, very rapidly. And when you work fast, there's the opportunity for errors, and errors are opportunities for exploitation.
Right, so there's definitely a lot of third parties to keep in mind here.
There are. It's not just the people, too. A lot of the equipment, particularly in radiology and cancer centers, is likely managed and maintained by someone other than hospital IT. To even go further, there's FDA-approved devices all over a hospital or clinic, and those are kind of frozen where they get the FDA approval. That is to say, the operating system, the patch level, the security solutions that are on them are frozen because these things touch people's bodies, sometimes on the inside. So they want to ensure that they're safe, but that means that you have all these devices that can't necessarily be patched, and you have to look at external controls to protect them.
Yeah, so going back to the blog post in particular, so you've talked a bit here about access control. Also, we also have the fact that hospitals deal with actual patients and all of the people who are coming to visit them and deal with access that they may need as well. How are hospitals approaching then that issue of access control?
Well, they have much larger access control teams than a business in another vertical their size might have. They automate as much as possible. There's a lot of interest in third-party access control. One of the problems is, we'll use a physician, for example. She might practice at the adult hospital, the children's hospital. She may also practice at the VA hospital and also in an outpatient clinic. And these don't have the same access control systems. That's 4 or 5 passwords she has to remember and change. And typically there's also some 2-factor authentication involved. And that becomes very cumbersome. So centralized access control that can be used by a variety of organizations that are not necessarily connected is of tremendous interest, particularly amongst physician practices.
Going back to the IoT devices too, that you started the conversation mentioning, what is the solution there that hospitals are, what can they do to make those IoT devices a little bit safer and ensure some of those vulnerabilities get covered up?
Segmentation. And they already do this with the FDA devices. FDA devices are on their own tightly controlled network. But I think if they're using voice-activated communication amongst the nursing and medical staff, isolating that because it's become a critical part of the practice of medicine so that it's not vulnerable should another less critical part of the system be compromised. And always go back to paper. It's not just a malware attack that could potentially put you into being a paper hospital. There's a large academic medical center out in California that a plane hit a major transformer and they were relying on cell phone for a lot of their work as part of their, we don't have internet access. And the cell phone tower's battery started dying. So they have to think, and I know it's old school, but they have to think about what do we do to practice medicine if we literally have no computers to use at all.
And I imagine in 2020, especially, the telework issue is becoming worse, so to speak, as all these people are now being forced to work from home and sort of do outpatient care rather than inpatient care where they otherwise would not. So how have these new challenges of remote access been creeping up throughout the year?
It's a patchwork, and some are doing better than others, but there's a lot of Zoom going on. And there's a lot of folks who are doing just RDP to their desktops. And all of those, again, spread that battlefield out where there's all these potential points of entry. And it's also not just that things are moving from inpatient to outpatient telehealth. There's telehealth going on inside the hospitals. So say a patient has a mental health crisis and needs to be admitted to the ER. Well, the psychiatric consult is probably going to be done via video chat on a tablet. The psychiatrist is not going to come to the hospital.
Interesting.
They're trying to keep everybody out of the hospital who doesn't actually have to be physically there to do their job. The fewer people in a densely populated area, the less chance of spreading the infection.
And so does that telework side of things, combined with the fact that you have so many people who access the hospital that don't necessarily work for the hospital, does that just exacerbate the challenge there?
It does. Keeping track of who everybody is and what they're supposed to be able to have is a tremendous challenge. It's not a new challenge to hospitals, and they're pretty good at it, but it does take up a lot of resources. And with finite resources, are you going to work on your access control at the expense of your network segmentation or hardening your perimeter? These are all choices they have to make because they don't have infinite money.
Yeah. Another 2020 issue is field hospitals and facilities that have had to be stood up in emergency situations because of need for more beds, care, that kind of thing. How has cybersecurity come into play in those types of facilities?
There's a lot of VPNs going on. The equipment that's in the field hospitals is going to be connecting to likely a server or set of servers back in a physical plant that connects to the electronic health record. It's going to depend on which electronic health record the hospital is using and whether it's something they have in-house or in a co-located data center. But there's other parts of it that are more tactical. Just if you have field hospitals and you have all the news people coming to see your field hospital, how do you maintain patient privacy? Even the same thing with the video consults. You have a privacy violation if you're doing a psychiatric consult and your 16-year-old walks by the open door to your office and sees the patient's face on TV or on the computer. The field hospitals, they're not as big a threat because they're not really storing data there. Everything is going back to where the data storage is for the main hospital with which they're associated.
Mm-hmm. Well, from the sound of it, just as you said, this isn't a new battle for healthcare providers. It's sort of a surge in the existing ones. So forgive me if this is a stupid question, but is there any end in sight? Is there an end at all?
Not really. Even if we were to take out the monetizability of electronic health data that's present because of the possibility of insurance fraud, you still have the possibility of exfiltration of data for purposes of extortion of individuals or exfiltration of data for embarrassing the hospital, as well as the constant concern about integrity. I mean, hospitals are embarrassed and they may be fined if there's an exfiltration of data that exposes private health information. But the real nightmare is someone gets in and monkeys with the integrity of the data, so they can't trust it.
We know that the attacks are going to continue, and they've really only, increased over the past couple of years, really. I mean, this was already a problem for hospitals last year before we even got into the pandemic situation with ransomware being sort of an increase there. Are there any other sort of magic bullets that you could share for healthcare organizations to better protect themselves against this?
I'd put it into two things. Preemptive measures, including network segmentation, that is internal firewalls. Separate the systems so that they can't infect each other. Separate the users from the system so they only have the minimum access necessary to get to the things that they're doing. Good endpoint security, including things that are going to be able to programmatically detect phishing and other scam emails that might potentially provide an avenue into your system. Now, even the best security is not going to keep all of these things from being successful. So in the reactive situation, have the ability to close off infected portions of the network or infected devices, and good backups, an air gap between where your backups are stored and where your systems are. Bare metal restore practices. That is, practice restoring critical systems from backup. Don't just trust that you've got them and you know what you're going to do. And also the drills, which hospitals that can afford to do this, doing the drill of what do we do if the computer systems aren't available, so that everybody's practiced it and it's not a completely foreign concept when it happens.
From a personal perspective, having worked in the healthcare field for a number of years, what does this do to you when you see a real concerted attack wave that's coming to the industry?
It breaks my heart. These people who work in healthcare, they care about their patients. They care about providing care to people, and every keystroke that has to be used to provide additional security is a time when a physician or a nurse is not looking a patient in the eye, not getting more information about them to provide better care. So what these concerted attacks do is they make all of this data-driven work that we've done to improve healthcare more burdensome on the actual clinicians and healthcare providers, because they have to be part of the security solution and they've got finite time. They're not taking care of patients when they're typing in passwords.
All right. Is there anything else you wanted to add?
I think that we as consumers of healthcare can be part of the solution by protecting our own passwords, using strong passwords, using two-factor authentication where possible. So one of the attack surfaces, although it's a relatively low threat vector, are these portals where you can go in and get updates on all of your medical stuff. But even though it's a low threat vector, it's a large surface area because there's so many of us using them. So if we, consumers of healthcare, use good passwords, use two-factor authentication, and protect our credentials for that, it's one less thing for the IT folks to worry about.
Great, Barbara. Thanks very much for joining us.
You're welcome.
Now it's time for headlines. In this regular segment, we take a closer look at a few top stories in the cybersecurity world and talk about what they may mean to you. Now, headline number 1. Marriott fined £18.4 million by UK watchdog over customer data breach. So we start our headlines across the pond with a breach-related fine levied against global hotel giant Marriott. The Information Commissioner's Office, or ICO, has fined the company that aforementioned £18.4 million, which as of today would translate to about $24 million for a data breach that affected the Starwood resort chain starting in 2014.
Right, so those familiar with ransomware news in general, there's no way you don't know about the Marriott breach. Back in 2014, as you said, there were quite a few different types of information stolen from the guests of the Marriott, which included names, email addresses, phone numbers, unencrypted passport numbers even, as well as all the usual hotel-related arrival dates, departure dates, VIP status, things like that. So quite a bit of information that was stolen at the time.
Yeah, and this was stolen from the Starwood chain, which actually was independent at the time. They included hotel brands like Sheraton, Westin, Le Méridien, the W hotels. These are all pretty big name hotels, and Marriott ended up purchasing Starwood just about a year after this breach began.
Right, so the initial breach was in 2014, and it was not discovered until September 2018. So at some point during that sale, the attackers netted themselves a much larger fish by accident.
Yeah, and that breach led to approximately 339 million guests having information stolen. Just 7 million of those were connected to the UK, but that's what this fine is relating to in particular.
Right, and the ICO does recognize that Marriott was very quick to act after the breach was discovered. They contacted their customers as well as the ICO themselves as soon as possible, so to speak. So that was considered in the final punishment as well.
Yeah, and when you mention final punishment, that's the interesting point here, because actually back in the summer of 2019, the ICO initially recommended a penalty of over 99 million pounds, which would be about $130 million if you're scoring at home. So that's, let's see, 6 times or so what they're ending up with.
Right, and then that's where the whole story gets caught up in Brexit and all sorts of things. The GDPR regulations that take place in the European Union were in effect as of May 2018, and then, of course, the UK left 2 years before that, so it's a little strange who's going to have the jurisdiction and what exact regulations were violated here.
Right. Yeah, the General Data Protection Regulation, which I'm sure many of you have heard of already, is an EU law regarding data protection and privacy that penalizes organizations for not taking necessary measures related to data security. It seems in the research that I was able to do that it looks like somehow the UK is still sort of operating under GDPR in some way as well. So yeah, there is kind of a nebulousness about the connection now, though.
Right, and of course this is a worldwide issue. It's not.
Yeah.
It's not Marriott National. It's Marriott International. So there could be further fines from different locations in the pipeline as well.
Yeah, I did see at least that the New York Attorney General was investigating this as well. We just recently did a story about New York fining Dunkin' Donuts for a data breach. So you know that they're one of those states that's maybe a little more active on the cybersecurity penalty front. So wouldn't be surprised to see something come out of there as well.
Right, and the ICO themselves also just recently fined British Airways for also data theft affecting their customers. So you can see quite a bit of these cases are coming before courts now.
Yeah, and just going back to the numbers that we ended up with, one of the other reasons why the fine was lowered considerably from the initial recommendation last year, you mentioned that Marriott cooperated and has been taking measures ever since discovering the breach. But the other reason is the coronavirus pandemic. I guess the ICO is taking mercy on them or something because the business has been struggling this year. Hotel business, not maybe one you want to be in right now. Marriott's reporting about $85 million a month in losses overall, and that definitely played into the reduction in the fine amount as well. And you mentioned British Airways as another one that was just fined by the ICO. That was also lowered from an initial recommendation to a fine of £20 million. And again, the airline industry, another one that's had some trouble this year.
Right. They're looking to punish, not destroy them.
Yeah. Now, headline number 2. The BBC experiences 250,000 malicious email attacks per day. So since we started in Great Britain, figured maybe we could stay over there. We've been doing a lot of UK stories lately. So
It's true. They've got quite a bit going on over there, it seems.
Yeah, shout out to the UK. So a Freedom of Information request has revealed that the British Broadcasting Company, aka BBC, faces more than 250,000 malicious email attacks a day. This was done by the Parliament Street think tank, and it says the exact number is 283,597 per day over the first 8 months of 2020, which adds up to nearly 52 million.
Yeah, this is going to be one of those stories with a lot of statistics and numbers, so strap in.
Yep.
I imagine that 283,597 is an average, not they're hitting that exact number every day, to be very precise.
It sounds that way. It sounds like they basically had the whole total number, though they were able to at least divide it up into like which months were the worst and that sort of thing. So it got a little bit more detailed than just here's 8 months worth of data.
Right. So of these emails per month, 6,700 and some are classified as spam. So I assume they've got a pretty good spam filter at the BBC.
Yeah. The story breaks these down as emails that are classified as scam or spam messages, and then specifically malware attacks, emails that contain malware attacks like viruses, ransomware, and spyware. And that averages about 18,000 per month. Yeah, I think one of the big takeaways of this, which you just alluded to, is this is what's coming at them every day or what's coming at them over the first 8 months of the year, and yet no breaches this year, as far as we can tell.
Right, and then the month which contained the highest amount of recorded incidents was July. It surprised me. I figure it'd be a little earlier in the springtime to sort of better fall in line with the COVID timeline.
Yeah, I know the story that we were working off of in Info Security Magazine mentioned Barracuda talking about how those malicious phishing emails had increased like something like 600 some odd percent in March, starting with at the beginning of the pandemic. And we've talked about that with other guests in the past too, but it hasn't really died down per se. It's just evolved over the course of the time.
Right, and as you mentioned, all these attacks this year, and so far no breach that we've heard of, but this isn't really the BBC's first time dealing with this. They have been on the receiving end of a handful of cyber attacks, including one back in 2013 where sympathizers of the Syrian President Bashar Assad took control of the BBC's Twitter accounts to post messages of support and send phishing emails around.
Yeah, it's always interesting to see what people do when they actually have a successful breach. We didn't do this story on our last episode, but we had the story of the hacker who has been able to infiltrate the president's Twitter account a couple of times, but each time he's just reported it and they've fixed it and he hasn't done anything. So
yeah, that wasn't exactly advanced breach, so we didn't feel the need to cover it. They guessed the password. But yeah, so the BBC itself has plenty of experiences of dealing with these. It's a very large entity, so I imagine they've got a pretty hefty cybersecurity department that deals with this stuff on a daily basis. But those numbers are kind of astonishing to me.
Yeah. Yeah, I mean, I think, you found this story, and it's a really interesting example to just hear actual statistics of what a large organization, is facing on a day-to-day basis. So the BBC is actually the largest broadcaster in the world in terms of the number of employees, and because it's a public service broadcaster established under Royal Charter in the UK, that's why they have to divulge this information.
Don't want to mess with the royals.
It's interesting, too, because we have all of these major organizations, and occasionally they do get breached. I mean, Marriott is an even bigger one than the BBC, but you don't really think about how many threats they're facing. You can think about your own personal email and know that you probably at least get a few a day, so just multiply that out by the number of employees, and it is a pretty big deal.
And it only takes one to successfully breach, so
yeah,
statistically, it shouldn't be that hard.
No. And, in addition to whatever type of cybersecurity measures in terms of solutions they have in place, I would think that maybe because they've already had a breach or two in the past, and this is a news organization, they're fairly plugged in, and you'd think fairly aware that there are some dangers out there cybersecurity-wise that may help them with a pretty educated workforce, too.
Right.
Now, headline number 3. What are the fastest growing cybersecurity skills in 2021? By the way, before we get into this story, did you know that the BBC is also often referred to as the Beeb or Auntie Beeb?
I had not heard that. Now I know.
Just wanted to get that little factoid in there before we got away from it.
That's why people tune into this show, Captain.
So anyway, the fastest growing cybersecurity skills in 2021. We've talked about the need for more trained employees in cybersecurity more than once here on Ping, and now we get some more specific insight into what particular skills are most in demand in the U.S.
Right, and if you were a big fan of the numbers and the stats in the last story, you're going to be an even bigger fan of this one.
Yeah, hopefully you're not statted out with the election and everything by the time you listen to this.
So a company named Burning Glass has predicted the fastest growing skills over the next 5 years in the cybersecurity space, and not a huge surprise to me, at least, what the top candidates were cloud security. We've all seen the AWS commercials where we find out that everything we know and love somehow goes through Amazon. So the cloud security aspect, specifically with Azure security, Google Cloud security, and public cloud security, are very much in demand and will get you paid.
Yes. So you can expect an extra $15,000 a year in salary due to demand. And there are a couple other ones that give you a pretty good bump too. DevOps, risk management, and app development security pros can expect about a $12,000 to $13,000 bump.
And app development security is the number one growth as far as available positions are concerned, projected to grow 164% over the next 5 years.
Yeah, so just going in that top 10 order of projected growth over 5 years, you mentioned app development security, then there's cloud security at 115%, so that's pretty good too. Risk management, threat intel, incident response, compliance and controls, data privacy and security. You wonder if that might keep going up too. Access management, security strategy and governance, and health information security, something we've just been talking about throughout this episode. In fact, 400,000 plus jobs were posted looking for health information security pros from October of last year to this past September, which leads all areas.
I'm really surprised to see health information at the bottom of the list rather than at least the middle of the pack.
Yeah, you wonder if maybe they're not projecting the growth because maybe that growth has already happened to some degree, and that's why it was tops in terms of the job postings over the past year, because they're expecting those maybe to be filled by then.
Right, and this article does also include a heat map of sort of where this supply and demand breaks down in regional terms, and unsurprisingly, across the board for most of all 50 states, the demand is pretty up there.
Yeah, very much so. It actually looks like Maine has the smallest amount of demand. There's one of the versions of the heat map has every state with the same color in terms of that supply-demand ratio, except for Maine, which has a little bit lighter color because they have a little bit more in the way of job professionals compared to job openings.
Right, and as far as where these job openings are located nationally, it wouldn't be a huge surprise. Mostly East Coast, West Coast, Florida, Texas, so around the Gulf. So where those tech centers are already large and growing.
Yeah, one of the statistics that you'll find on the map is the actual number of openings for every area. It's done by state or by a metro area. And yeah, the numbers are, largely correlated with population centers, as you say. But it seems like if you really wanted to do cybersecurity just about anywhere, you probably could find a position somewhere.
Right. Might be a little harder in some areas, but it's available, except in Maine.
Yeah. And of course, I'm not sure how much this is affected by the growing remote work opportunities out there as well, because, a lot of this stuff certainly can be done remotely, and then maybe all bets are off in terms of where you want to live for doing any of these careers.
So one of the things on the heat map that sort of drew my interest was the breakdown of how many job seekers hold certificates versus how many job openings were requesting those certificates. Mm-hmm. The worst skewed, so to speak, is the CompTIA Security Plus certificate, of which 151,000 roughly are certified, compared to only 47,000 jobs asking for that certification.
Yeah, and there were a couple that were skewed the opposite direction, where many more jobs were asking for a certification than actually had people who had said certification. So, what this does is, certainly, we've already talked about the fact that there's a shortage in cybersecurity workers, and the Bureau of Labor Statistics actually says cybersecurity jobs will continue growing 31% through 2029, which is over 7 times the national average in job growth. But yeah, what this does, if you're thinking about getting into a cybersecurity career, or maybe you already are to some degree and you don't know which direction to specialize in, you
got some starters.
Yeah.
For sure, get the Certified Information Security Manager certification, which has almost 3 times more demand than there are certification holders. So if you're looking to snag some certifications in the new year, that might be the one to gun for.
Yeah, right. And, some of these are more complicated than others to get in terms of certifications. And, there's a variety of different backgrounds that you need for a cybersecurity career. I hear ballet is a good place to start.
Yeah, well.
Yeah, shout out to the last episode. But yeah, there's obviously an opportunity if you're in a career that maybe you're either not happy with or is just not working out in terms of financial opportunities for you. Obviously, there are a lot of job sectors right now that have been adversely affected. So something to consider to maybe devote some time to getting some cybersecurity training, even if you don't think this is going to be your long-term career. Maybe if you can get into it and get up and running, maybe within a year or so, you can get started.
You might find you like it. Who knows?
Yeah.
And there seems to be, just diving deep into the heat map and the specific supply-demand breakdowns in the article, there are so many specializations out there that you've got thousands of paths you could take from your beginning steps.
Yeah, you mentioned at the outset of this story, the cloud security area breaks it down into a top 5 of those with the highest projected growth. Got to imagine that each one of these areas has at least a top 5 there. There are so many different corners of the online world that need to be secured, and there are probably, within this 10-year period that goes through 2029 on here, there are probably going to be several that we don't even know exist just yet that'll be big by the end of that time.
Well, I didn't know about half of these existed, so I'm well ahead of the curve.
Thanks for listening to this episode of Ping, a Firewalls.com podcast. And thanks again to Barbara Vibbert with SonicWall for joining us. Check out the links in the description for more information about everything we discussed. Subscribe or follow now, however you listen, to ensure you get our latest episodes as soon as they're available. And please do rate and review us. Visit Firewalls.com for all your network security needs, and give us a follow on Facebook, Twitter, and LinkedIn. For Andrew Harmon, I'm Kevin Baxter. We'll be back soon with another episode, but in the meantime, we remind you to
Get secure, stay secure.